All right, looks like a handful of people joined in, so I think we're ready to start. Hi, everybody. I'm Corey Mullins. I'm from iatricSystems, and I'd like to welcome you to today's webinar. Our topic for today is a clinical transformation, smart pump programming. As a reminder, this webinar will be recorded for quality purposes. Now, I'd like to go through some housekeeping really quickly. If you experience any technical issues, please let us know in the Q&A panel. You can see that on the screen as far as clicking Q&A, and it'll open up a discussion. Just paste any of your questions, concerns there, and we'll be able to address them accordingly. If you'd also prefer, you could email us at webp@iatric.com. We encourage you to ask questions throughout the webinar, and you can enter those in that same Q&A panel. We'll be answering all of your questions in today's presentation somewhere near the end. After this webinar concludes, we're going to be sending you out a short survey and would appreciate it if you could take a moment to fill that out and provide your feedback. Also, this webinar is going to be recorded, so if you have any team members that weren't able to join today, you can respond back to that survey, email us at info@iatric.com or even WEBP, and we'll be able to give you a copy of that recording so that you can share internally. With that, I'd like to kick us off and introduce our moderator, Alberta Guy. Take us away.
Thank you, Corey. So my name is Alberta Guy, and I am a nurse by profession and have been with iatricSystems for 10 years. During that time, I have been doing smart pump integration. Our webinar today is a clinical transformation, which involves assessing and continually improving the way patient care is delivered. And that is the core of smart pump integration. Our goal today is to discuss with our panel from San Luis Valley Health their reasons for pursuing smart pump integration, with our Ivenix pumps presenting both the successes and the opportunities they experienced during the project. I'd like the team to introduce themselves. So Brittany, if you would like to get started.
Thank you, Alberta. I'm Brittany Sowers. I'm the Director of Nursing Professional Development here at San Luis Valley Health. I've been with San Luis Valley Health for almost 20 years now. San Luis Valley Health encompasses 2 hospitals and 6 clinics in southern Colorado. We have a level 3 trauma center and a level 4 critical care hospital, and we enjoy serving the community here in rural Colorado. And I'll give it over to Kate.
Hi, I'm Kate Blount. I'm the Education Coordinator at San Luis Valley Health. I've been with the hospital now for a little over 11 years, and I've been a nurse for 17 years. My background is in ICU and cardiac. And I'll give it over to Cindy.
Thanks, Kate. My name is Cindy Jackson, and I've been with San Luis Valley Health for 25 years. I've been working as a nurse informatics specialist since 2012. My background prior to that was a surgical RN, and I'll hand it over to Tandra.
Thanks, Cindy. My name is Tandra Dunn. I have been with the hospital for 25 years as well, and an RN for the last 16 years. And I've been in my current position for the last 6. Alberta?
Thank you, Tandra and the team. What we will cover today are the reasons and goals for smart pump integration, some of the project opportunities that we experienced, medication alignment, auto documentation, and we'll finish up with nurse education. A smart pump integration project is not plug and play. It takes approximately 6 months from the time the hardware is ready to complete the necessary drug alignment for testing and go live. This bidirectional solution utilizes iatricSystem's Accelero Connect, sending the IV medication order data to the smart pump gateway, which is auto programming, and receives IV data from the smart pump gateway, sending it back to the EHR or auto documentation. When talking with hospitals about integration, the common goal I hear is patient safety, as well as capturing start and stop times for improved reimbursement. Recently, I had a customer wanting to lessen adverse events, which can be prevalent when manually programming the IV order onto the pump. Brittany, would you like to share with our audience the reasons your team was pursuing smart pump integration, were there any key metrics you were aiming to achieve, like improvement of smart pump drug library or missing charges?
Yes, thank you, Alberta. So San Luis Valley Health had a few goals in mind when we were looking at the smart pump integration. First was, of course, improving patient safety by decreasing medication errors caused by incorrect programming of IV medications and IV pumps. One of the big errors that a lot of hospitals have is that a drug is entered incorrectly from the drug library or as a dosage is put into the pump incorrectly. So with the smart pump programming, the EMR is able to send the exact order as it is ordered into the pump correctly. The nurse scans the patient, scans the medication, and then scans the pump, and it's processed by the EMR. And if there is an error, it will immediately, in any of those steps, be apparent, and the medication is not correct. We were also looking at efficiency and workflow for nurses, as that is a big part of making efficiency in the hospital good. With smart pump programming, the number of steps to program the pump is decreased, and because of all titrations, pauses, and stop times are integrated directly into the patient's chart, this decreases the amount of charting for nurses on those medications. It also captures the correct time of any of the changes in the rates. As nurses, we all know that there are times when we walk into a room and notice that the medication is done infusing or that it has occluded or there might be some other issues, but we may not always have any idea of what time exactly that occurred. With smart pump programming, the exact time is documented for us, making charting much more accurate and easier. This relates to the final reason that we looked for smart pump programming, and that was revenue capturing. We charge for medications such as antibiotics and boluses based on when the actual stop time of the infusion is charted. We were having issues with stop times being charted accurately or even documented at all. Sometimes nurses get busy. With the smart pump programming, the nurses no longer must document a stop time. This because it's automatically done, and this improves the revenues for us, and we're able to capture that back over. Since we have smart pump programming, we've seen improvements in all three of these areas.
Thank you, Brittany. Let's talk now about some of the project opportunities. The process of auto programming begins with iatricSystem's Flex Button application. This button sits on the MAR and captures the medication order data to display on the Accelero Connect smart pump programming form. I know this explanation about Flex Button is far from clinical, but important to understand the necessary pieces that have to fit together to make smart pump integration successful. In the web expanse version, the Flex Button requires a script link browser extension to work properly. It can also be affected by the antivirus software. In preparation for Go Live, San Luis Valley Systems Administrator was wanting to get a jump start on deploying the Flex Button to the nurses' workstations. The network team uses a product called PDQ Deploy. Although iatricSystems does not recommend or support any type of deployment product, my Flex Button team member offered to help him resolve the issues. In addition, the project team, those on the panel today, were also experiencing issues with Flex Button disappearing on the MAR during our testing sessions. Again, my Flex Button team member met with them and attended the testing sessions to assist with finding a resolution. Cindy, you were our main tester during the project. Would you like to share with the audience the opportunities we experienced with the Flex Button during the project?
Yes, thank you, Alberta. The disappearing Flex Button issue slowed down our project. It even at one point became a showstopper. But after meetings and reviewing the error logs, it was determined to be the specific setup on my laptop. Unlike our nursing workstations, my laptop was set to auto lock after a period of inactivity, which would terminate the script link browser service, and this prevented the Flex Button from appearing. We've had a few reports since we've gone live of the button missing. Our technical team ended up re-imaging 2 computers and reinstalling the Flex button. We've also recommended to staff to close out of Meditech and the browser and restart if the button is missing, and this has seemed to help.
Thank you, Cindy. So let's talk about medication alignment. The most important patient safety aspect of smart pump integration is to lessen the manual keystrokes on the pump, which helps prevent medication errors. The process of drug alignment and testing every medication is core to completing the project. Again, Cindy being our main tester, how would you describe the process and any words of wisdom for the audience?
One of the first hurdles that we experienced was getting an accurate medication list out of Meditech. Alberta needed this list to import into Accelero Connect. The list needed to be in an Excel format, and it was not easy, but we had some assistance of our SQL writer, and Ivenix also helped us, and we were able to successfully get what she needed. Alberta prepared a testing spreadsheet listing the Meditech drug formulary IV medication by mnemonic. For each testing session, we would need to order the medication from the spreadsheet. However, Meditech doesn't display the mnemonic in the order strings, so from the OM side, you are unable to see what mnemonic it is that you're ordering. So we had to do our ordering using the pharmacy application. We also utilized Meditech's oncology module here at San Luis Valley Health, and this required entering orders from our treatment plans. Thanks to our pharmacy project team member, Reina Reyes, who could not join us today. She assisted us with the input of those orders. It was important for us to get the infusion center up on smart pump integration. The project would have gone much quicker without testing all of our chemo and infusion medications, but testing is very important, and we spent many meetings testing and sometimes retesting.
Thank you, Cindy. And you're right, it's a lot of testing, but it helps with the success of the project when you go live. Let's talk now about auto documentation. When the project began, I gave the team guidelines for building the queries, the documentation sections, intervention, and med workload dictionary and expanse. But I remember the disappointment when we discovered it would not integrate with some of the functionality of the titration workflow embedded in Meditech. The Accelero Connect application offers a solution that allows for our critical drip documentation to be separated from the general IV therapy documentation. This requires separate queries and interventions that are entered at the medication level in the med workload dictionary, and also get added to the Expanse R1716 monitor interface dictionary. Tandra, I know your team got creative with rules and widgets. Can you please explain for the audience why those items were necessary and how they are working out for your staff now?
Thanks, Alberta. Let me first explain why the titration functionality would not work. Meditech only offers integration with one pump vendor currently. Our vendor of choice, Ivenix, is not that chosen vendor. Therefore, the embedded titration integration is not available. We needed a plan for those occasional times when a nurse couldn't smart pump program a medication and needed to do manual documentation. After realizing that we would lose our infusion mapping functionality, which allowed for fields within our electronic EMR to be auto-filled with order information, volume intake, titration data, and so on, we began to think outside of the box on how we could make the EMR work as efficiently as possible for our nursing staff. To ensure the nurse would be prompted to return to the EMR to document the IV fluid stop date, time, and fluid volume, we created rules within the system that would create a flag on the EMR to remind staff to do this documentation. When the nurse first administers an IV medication, they are asked to document whether they are smart pump programming the med or giving it manually, so not smart pump programming. If they select that they are giving the medication manually, this will then trigger the rule to notify the nurse to return back to the EMR to finish this documentation at a later time. This reminder can quickly be seen on the status board and can be easily found within the MAR. We also discovered that our smart pump medication administrations would not show on our EHR's medication tab like we were used to. Because of this, we decided to use widgets within Meditech to view our IV fluid auto documentation that comes in from the smart pump. Widgets are very customizable and can be used to view specific patient clinical data directly from the patient's chart. We wanted an easy place for our nurses, providers, and coding staff to be able to view this documentation, and this workflow worked perfectly for us. Within this widget, the user can see IV fluid start and stop times and IV fluid intake, and it can sit on the front of our chart for easy access.
Great information, Tandra. Thank you so much for sharing that. Let's move on now to education. Education on a new workflow is crucial. I had projects during COVID that resulted in minimal training of the end users for obvious reasons, and the usage of smart pump integration was poor post go live. Since then, these hospitals have been able to provide re-education that has improved utilization. In addition, the Accelero Connect application has a compliance reporting tool that can assist with monitoring usage, drilling down to the care unit or user level. Kate, you were instrumental in the education process. Would you like to share with the team what was successful for implementation and support of smart pump integration?
Yeah, thanks, Alberta. So we all know that nurses really fear change, and so one of the big hurdles in education is getting staff to buy into a new workflow. So a lot of the fear staff has is not feeling like they've had adequate education. So we really tried to focus on making sure our nurses had the education and the resources they needed to feel comfortable when we went live with the smart pump programming. So we started by creating an FAQ sheet and some troubleshooting tip sheets to hand out to the staff and to leave on the units. And then we created some short case studies and scenarios to review and for staff to practice with during the education sessions. At the sessions, we started by focusing really on how that smart pump programming would improve the workflow for the nurses and capture that revenue like we discussed earlier. A few of the key points we brought up were that they no longer would have to document stop times for antibiotics and fluid boluses or their titration rates because these were captured by the smart pump programming. And this decreased the amount of steps needed to program a pump. And it also improved patient safety. We then demonstrated all the steps of administering IV fluids, secondary medications, and titrations of medications. We discussed the changes in documentation to IV medications when a medication or fluid is hung, either by smart pump programming or via gravity or manual programming. There was also a big focus on where to find this documentation in the EMR. Once we demonstrated this, we had the staff break into groups and work through those case studies to appropriately administer and document primary IV fluids and secondary medications, and then titration of medications. The first week we had 1.5 hours training sessions with our super users. And then we created several sessions for the rest of our end users, and each session was an hour long. We had education be mandatory, and we were able to get about 95% of our staff to attend live sessions with us. So during and after go live, the education team made frequent rounds with the nurses to answer questions and to walk through the steps. And we've continued to round weekly in order to discuss concerns or issues with staffs on smart pump programming. And then just last week in our skills fair, it had been about 6 months since we implemented this, and we did a review to make sure everyone was feeling comfortable and to answer any questions that they had at that time.
That sounds wonderful, Kate. And great team effort by all of you. And it does take a team. It takes pharmacy to provide insight and knowledge about the medication orders and the safe administration of them. It takes nursing informatics who are instrumental for understanding the workflow as it relates to documentation and the accuracy that's needed for optimal reimbursement. Nurse educators provide the crucial training and support necessary for successful transition to the smart pump utilization. And having an advanced integration product like Accelero Connect to assist with drug alignment is instrumental to the successfulness of implementation. That concludes our panel discussion. I would like now to open it up for any questions. So Corey, do you have anything in the questions pane?
Yeah, thank you, Alberta. A quick reminder for everyone here. The chat is closed off, but the Q&A panel is going to be where you enter in your questions. So right at the top of the screen, you see the Q&A panel. You can enter your question in there, and it'll be reviewed and answered very shortly. To get things going while we wait for people to navigate over and enter in their questions, I do have a couple questions prepared for Alberta. The first is, and I think a very common misconception we hear quite a lot, do we need meta text permission to do this?
The answer simply is no. We have been doing smart pump integration for 10 years. We can integrate without meta text permission. We do not use any of their embedded integration hooks that they may have. We leverage the monitor interface and for Expanse, that is R1716. It is merely a separate entry from the other entries that might be there for vital signs and such. So we can do the project without Meditech's permission. Thank you, Corey.
No, that's great. And I know you mentioned Meditech Expanse, but can we also do this for, say, Meditech Magic?
Absolutely. We have done smart pump integration with most of Meditech's platform. We started with Magic, and in fact, we have an 8-hospital unit or groups of hospitals that have been live for about 6 years now. So yes, we can do Magic, 6X, Expanse 2.1, and Expanse 2.2.
Perfect. We're going to keep the questions open for just a little bit longer. If you have any, please feel free to enter them in now. One other one, Alberta, that comes up pretty often is some hospitals use a different pump vendor. I know for this presentation, we're focused mainly on Ivenix, but do you need a specific pump vendor to do integration with Accelero Connect?
You do not. Ivenix was a great team to work with. But we have also successfully done smart pump integration with ICU Medical, BD, and BBRON. And we also can do multi-pump vendor. So if you use a certain pump within your, say, PACU, that's different from your pump vendor that you use out on your general med surg areas, we can also handle multi-pump vendors. We can also do PCA and syringe. So if those are an option for a hospital, we can accommodate that as well.
No, that's great. I don't see another question that came through the chat. Now, that doesn't mean that the conversation needs to end here. So my last question, Alberta, is how do we get in touch with you all?
Well, first of all, San Luis Valley Health, the panel team, has been so gracious to allow us to provide their information. So if anyone has specific questions for the team on the panel, their contact information is on the screen, as well it will also be put in the chat. If you need to contact me with specific Accelero Connect questions, my contact information is on the screen, alberta.guy@iatric.com. So Corey, I'll turn it over to you to see if there are any further questions or how the team can contact iatricSystem sales.
Great. Yeah, really, it's thank you, Alberta, and thank you to our wonderful panelists from San Luis Valley Health. And also thank you, all of you, for joining the webinar today. Please feel free to reach out to us on social media. We are iatricSystems on all platforms. And if you have any further questions or would like a more in-depth conversation about Accelero Connect, you could always reach out to your account executive, info@iatric.com, or even Alberta Guy directly, and we're going to connect you to the right person. I'd like to say thank you, everybody, for joining, and I hope you all have a great day. Thank you.